Well, that's a good way to close, and so we'll all have like a final comment. And we'll start, Carlos, would that be your final comment, or would you like to make any comments about where you think breast cancer is going to go in the next couple of years?
Well, I think I was thinking beyond 2 years, but I would like to put a plug for trials, neoadjuvant trials in ER-positive disease. I think we talked a lot about combinations with everolimus, with PI3 kinase inhibitors, with et cetera. And let's face it, in the metastatic setting, what we're doing is we're temporizing the disease. I think that's meritorious, but it's not going to be transformative enough. I think as we identify those patients that need that second drug to the hormonal therapy based on a genotype or whatever, I can see a situation where we do neoadjuvant trials, because I think we know from what we know about cancer biology and other examples in other tumor types, that if you do the right therapy early, that effect carries over. So I would encourage to our colleagues in the community to stay tuned to those neoadjuvant trials with hormonal therapy plus minus a targeted therapy. I think that, so I think I'm excited about that particular area of research, of clinical research, in the next 5 years.
Good. Joyce?
I will highlight the androgen receptor as a very important new target in breast cancer, and we'll hear data on enzalutamide in the triple-negative AR-positive, and I think that, of course, we need more data, but I do hope that there'll be some consideration for getting that on even NCCN guidelines until we get more data. I think so. I mean, I know it's early yet, but we really it's now we've got 2 studies that targeting AR can be helpful in triple-negative breast cancer, and particularly with this new gene expression profile. It's just one of those targets that we know is getting some legs, and it's very difficult to target it. Also in ER-positive breast cancer, I think it's going to be an important transcription factor mechanism of resistance that leads to transcription of her family members and a lot of other resistance mechanisms. So I'm very excited about the AR as a new target in breast cancer.
Edith?
Very enthusiastic about collaborative efforts nationally, globally, to uncover 2 main areas: genomics, immunology, in the context of patients participating with us in the not only design of the clinical trials, but timely conduct of the clinical trials with appropriate biomarkers. I think major advances will be seen in the next few years because of this collaborative effort.
Good. Debu?
I'm very excited about the analytics, the new diagnostics that are going to tell us what clones evolve over time that dictate resistance, what epigenetic changes are going on, which genes are being silenced. Because I think these are going to point us into the right combinations and how to personalize them for patients. So we haven't focused as much on the analytics, but I think that's key. And of course, as you know, all of our modern day clinical trials now have these built in, and I think that's critical.
Denise, last word.
So, I agree with everything. I think the biggest thing is really revisiting this whole era of the metastatic disease and sampling that. I think it's critical to us understanding and moving forward with a treatment in all of the arenas, whether it's the triple negative, the ER positives, or the HER2 positives. And I really see us gaining so much information from that I think a lot of the monotherapies, whether it's monotherapy, chemo, hormone therapy, HER2, we've already seen with dual HER2 therapy, that era may be gone, and it's all going to be some way integrating a standard with an additional targeted agent from many of the different baskets.
Great. Well, I'd like to thank all of you. I think this has been a really kind of fun discussion, and thanks for participating in this. It's been, I think, highly educational and spirited. And again, on behalf of our panel, we thank all of you for joining us and hope you found this peer exchange discussion to be both useful and informative. Again, thank you very much.